And now we're going to move on to why we're all here. Dr. Gartner specializes in neuropsychological assessment from early childhood through adulthood. She has significant experience and training helping individuals and families determine where their true struggles lie in order to inform the most appropriate services and help them live up to their potential. As director of the assessment program at the Family Institute at Northwestern, she emphasizes the use of the highest standard of assessment tools, an elevated level of intellectual collaboration, and a supportive environment for clients to feel at ease while engaging in the assessment process. And with that, Renee, thank you so much for being here, and I'm going to pass it off to you to start us off with the presentation.
Awesome. Thank you, Cassie, and thank you for everyone for coming, for being here. I know the poll just popped up, so if you don't mind answering just 2 quick questions, that would be really helpful, and I'm actually going to touch on that a little bit later. So, neuropsychological assessment, how your child can benefit from testing at any age. What this presentation is going to entail, so the first couple minutes, we'll just talk about what neuropsychological assessment is, why it's useful, and what we do. And then after that, I'm going to jump into the different developmental periods and discuss triggers that may indicate a need for testing, some red flags that we commonly see and that we commonly hear from parents, caregivers, teachers, other professionals, and then how testing can be beneficial at the varying developmental levels. So let's get started. So, and a couple slides. So what is a neuropsychological assessment? So essentially, this is what I do, as Cassie said, on a daily basis. And also, if anyone has questions about specifically what it looks like in the testing room, or the actual process of testing looks like, I can answer that as well. I didn't think to add it in. Please put that in the Q&A if you do have a question. I'd be happy to kind of give you an illustration of that afterwards. So, what neuropsychological assessment is, it's a brain-behavior relationship. What that also does is it creates the distinction between neuropsychological and clinical psychology. So what we look at is how brain functioning impacts someone's behavior, essentially to determine how they're functioning internally in their body, essentially, is leading to their overt behavior. So what you may see to lead to an assessment. All of our neuropsychological assessments are standard, objective, and reliable. What that means is all of our assessments that we use are standardized, so they're based on norms. So we would never just say like, oh, your 5-year-old looks like they know their letters pretty well, and that's what we'll go from there. We would never do that. So we utilize quantitative data. All of our information is standardized in age ranges, so that would be the year and the month. And why we do that is because we want to see how the child is developing based on their same-aged peers. So what we know based on research of where they should be, we want to make sure that's where they are. Another area that is pretty good, pretty cool with neuropsych assessment and using the data is we're able to see their own strengths and weaknesses within themselves. So a lot of times during feedback, after testing is complete, which we'll also talk about today, is I'll be able to talk to parents or whoever is in for the feedback session about the child's own strengths and weaknesses within themselves. So we may be able to see as an example that their verbal skills are really high as compared to their visual skills, and how that may also impact their ability to communicate, social interaction, as well as even reading and math skills. So another area that what we're able to do. Next, the integration of quantitative and qualitative data. Quantitative data is kind of what I was just speaking on, so that would be the objective data from test measures. We do this by the one-on-one testing environment. It may be based on verbal questions, visual puzzles, questionnaires, visual spatial tests, and computer-based testing, as well as qualitative data. So really another huge portion that's important to us for neuropsychological testing are interviews. So interviews will be with the parents or caregivers, the client, a thorough history, teacher interviews, therapists, anyone else that may be involved. So this could be a speech and language pathologist, occupational therapist, pediatrician, therapist, the list goes on. And one of the biggest areas is that there are benefits throughout all of the age and developmental periods. I will talk about up into young adulthood, but the integration of all this data, we're able to create a comprehensive profile, which is why I believe that it is beneficial throughout the lifespan. So aspects of a neuropsychological assessment. So of course, these are some of the areas that we're going to look at. It's not exhaustive, and it's going to depend on the individual, so the client and their presenting concern. So whatever they're presenting with and whatever may be impacting them, we're definitely going to take into consideration on the assessment. Every assessment we do is different. It's always individualized. You can see a couple of the areas that we look at. Other examples just that fall within this range would be medical. We're also going to look at head injuries, strokes, genetic disorders, because through the research, we know of how it may impact academic concerns, different emotional, academic concerns. So that's important that we'll collect through questionnaires as well as a thorough interview and history. Previous trauma is something that's important to us, as it may impact one's overall cognitive and behavioral functioning, different relationships, sociocultural, their background, of course, all this plays a role to us. So why this is also important is the integration of data. So neuropsychological assessment, like I've been talking about, is there's a huge integration of data that we talk about throughout our entire evaluation that you would get after it is complete. And I also feel that this is one of the main differences and kind of benefit of neuropsych testing. So we look at all of the different components, background, cognitive, and behavioral, and see how they may impact each other and one's overall functioning. So we're going to talk in a second about how if one area someone may be struggling with, it's going to impact their overt functioning. So that's kind of another pro, I would say, of neuropsych testing, is we'll see how everything is working together. So actually going into that, this is kind of an example I like to just look at an illustration of what I've been talking about. So if we think of the components of a computer, there's obviously on the left-hand side of your screen, you'll see there's many small little pieces that can impact a computer's functioning. So for example, if the keyboard isn't working, it's going to impact your ability to potentially do your job. It would definitely impact my ability to write reports, chat with someone. It's obviously going to impact a lot. So how it relates to a human is, let's say someone's attentional abilities are a little bit weaker, it's going to impact their overt functioning. Or potentially their working memory or even short-term memory is a little bit more of a challenge for them. It's going to impact their ability to learn new information, to take in that information, and it's a common question that we get: why are they not able to take in the new information that's offered to them? So one part or cognitive aspect, if it's struggling or if there's a weakness there, it definitely can have a huge role on real-world functioning and impact overall overt functioning. So just a little example to get us going. Next, when is an assessment beneficial? So as I kind of alluded to at the beginning of this presentation, I'm going to be splitting age ranges up into developmental levels. So I know some of these levels are pretty broad, and part of the reason I did this is for timing. Another reason is because a lot of the areas and struggles that we notice are lumped together within these developmental periods. So it'll make more sense once we get through the slides, but you'll see I'm lumping together typically presented concerns that we see. So now actually I'm going to look at the poll real fast to see. I'm curious just who has any interaction with a neuropsych evaluation, and it looks like a lot of kindergarten, elementary, and early childhood is the majority. of what people are saying. So thank you for doing that. I really appreciate it. It's helpful for me. Good news is, I would say at least the bulk of our testing is going to be in the age ranges that you saw. We do some young adulthood. However, I would say the first 3 periods are the ones that we see the most commonly. So good audience for this. So thank you again. So when we get into these areas, what we're going to discuss are the red flags that may indicate a need for assessment at each of these stages, the areas that we test for within the stages. So they're going to include strengths and weaknesses, typical presenting concerns, how they may manifest within the home or academic setting, as well as diagnoses that we frequently utilize at each stage. We'll talk about that as well as we get into them. And obviously, how testing can be beneficial at each of the ranges. Next, really broadly, and then we're going to start with the preschool years. So when is an assessment beneficial? These are a couple of the general areas, and again, we're going to go into more detail. But first off, parents are concerned about some element of a child's development. So it could be something academic, attention, social. What we typically say in our rule of thumb is earlier is better. So a lot of people ask, is it too early to test my child at the age when they're in preschool for a learning disorder? And what we typically say is we can always get a baseline of functioning. We can always look at the data that we know that is normed and that we'll talk to you beforehand what we would be able to see. And I say the early is better because if you're able to intervene when they're really young, they're such a sponge at that age. So they'll be able to utilize that intervention, whereas if they're struggling in high school or young adulthood, it may be a little bit harder, depending on the problem, to help in that area. Teachers and tutors. So this is a very common area that we get referrals from. Why is the child not grasping material? They're acting out. They're avoiding. What are they missing? They're just unsure. Diagnostic clarification. So this is frequently school as well as even a therapist or even speech and language pathologist. Like, again, not grasping the material. Is this actually a reading disorder, or are they experiencing a language concern? Is it, are they on the autism spectrum, or is it just more of social emotional struggle, anxiety, depression? The list goes on. Next, a lot of what we see, especially here at the Family Institute, because we do have a lot of therapists, is the therapist will call us and say, you know, I've been seeing this individual for a couple months and I'm not seeing any progress. Are they understanding it? What is happening? And we've had a lot of different reasons that testing isn't, that therapy isn't working. And I think it's a really cool integration that we're able to utilize neuropsych with therapy. And we'll always invite the therapist in for feedback session if the family is okay with it. And just in order to make therapy more gratifying and more successful. Next, why can't my child make the leap to high school, moving out of the house, college, their first job? Again, really frequent, these people that failure to launch, living on their own their first time. We see that quite a bit. And then optimization of performance. So what is my child's profile? So we're able to show their intellectual skills, their strengths and weaknesses, what we think they would be more successful in. Is there an optimal learning environment or intervention that would be useful? So sometimes a child may benefit from more one-on-one setting, or maybe a larger group setting, maybe a Montessori, maybe a more structured environment. So we look at all of those. And also giftedness. So we test for that quite often and are able to help these really bright kiddos see how to challenge them a little bit more, in what areas we can push slightly because they're so strong in areas to grow as well. So let's move into the first period. So preschool years. So what I want you guys everyone to remember as we jump into this is that many of the red flags that I'm going to present on each of these levels can also be seen or accomplished in other developmental stages. The reason I have them listed where I do is because that may be the first or an early time where they're observed, but this does not by any means say that we can't look at them later on in life, and or that they're not observed by someone else later on in life. Also, these aren't exhaustive lists of difficulties or diagnoses. These are just what we commonly see. My apologies if I did forget something. I imagine I did. But many of these are, again, typical that we see during the years that I've listed. Additionally, I know we have diagnoses listed within neuropsych. We do diagnose, if it's appropriate, of course. But what testing also gives is strengths and weaknesses. So just because someone maybe does not qualify for a language disorder, we can say how potentially their receptive language is stronger than their expressive language, and it may be manifesting in life in a particular way that we can talk about, and also just discuss some ways to help increase that lowered expressive language use even without the diagnosis. So we look at recommendations and offer those in order to help any weaknesses that we see. All right, so some of the red flags that we notice in the preschool level. So let's see. So first, behind on developmental milestones. So a lot of what we notice in this period is that a child might not be talking as much as potentially an older child in the family or the friends. They may struggle to express themselves. They get really frustrated when they're not able to express themselves, and parents are concerned. Is it a language struggle? Is it emotional? Is it both? Or is it just a normal developing child? In terms of fine motor, kids these age are starting to develop their hand preference. They're developing grip. So we like to look at, are they struggling to hold utensils? Are they learning to tie their shoes, ride a bike? A lot of kids we see, parents will say they tried gymnastics and they were just so uncoordinated. A lot of these could be a red flag or a trigger of why someone may come in for testing. And then socialization is another big developmental milestone that we see. So parents will talk about they're engaging in more parallel play, so they're not interested in engaging with others. You know, a lot of times we'll say this is the third child in the family, and the first two loved playing with each other, and then the next one isn't interested. So a lot of times, obviously, as parents, you may see a benchmark for the first child, second, third, and so on, and there's a difference with one of the children. So we do see that quite often, and parents are concerned, is this something I should be concerned about, or is it an appropriate developmental period? And that's a really good presenting problem that we see. Next, very common, is the struggle with early academics. So one of the areas that we notice is obviously in preschool, and obviously before, we don't expect someone to know how to read. But we are looking at, are they able to learn their numbers, letters, colors, recognize sounds, starting to gain interest in it, and picking up the material. So many times they'll come in and say, you know, we go over B for weeks, and then I start with C, and then they forget B. Or we have the frequent, you know, the common switching B's and D's, P's and Q's. Is that developmentally normal in preschool, or is it something that we're maybe concerned about? So we definitely can look at that as well. Communicating with others, we kind of talked about this a minute ago, but this is a big one as they're aging, as kids learn to communicate with others. So expression, so are they able to say what they need, what's wrong, what's hurting them, have their needs met, and do they understand what's coming in? So if you're asking them to go upstairs and grab their backpack, or maybe help their little brother get a spoon out of the kitchen, do they understand what you're asking? So we get questions about this all the time. And then also social language. So this is a big one that we're going to talk about slightly, a little bit here, but definitely the next developmental period. Social language is how someone is able to utilize nonverbals, gesturing, positive and negative expressions in order to understand what's going on in the situation. So it's the function of language, so pragmatically how we use language. And this kind of can relate to if they're not kind of getting along with others, moving into the social skills? Are they not able to play with others? Do they not understand play? Do we want to look potentially at, do some testing for autism, or maybe it's just they're not attending to the information because their attention is a little bit weaker. So another area we look at, and then social skills. So in a young child, you know, we talk frequently about eye contact, their attachment with their parents, with strangers, their siblings, and appropriate play. What is appropriate play at this age? You know, I think there's a lot of discussion about that, and I don't think it is a black and white issue. There's a lot of gray here. And this is an area that I think we do see quite frequently. And another example of why, for this age, we'll want to talk to other people in the child's life to see how they engage with them. So obviously in the testing environment, we are going to be engaging with them one-on-one. We'll be able to observe how they engage with whoever brings them in. And then we'll also utilize questionnaires for preschool teachers or anyone else in their life to see what they observe. Also, what we're going to be interested in, kind of touching on that a minute ago, is the parental relationships, sibling, family dynamics, how it might be impacting the child. And then if we look at the examples of diagnoses we see during preschool years, again, not exhaustive, but it's a time when we will look at the autism spectrum, developmental coordination, which could be poor fine motor, they're kind of just awkward or clumsy we get all the time. They can't use scissors, tie their shoes, color with a crayon. And some of the great things I would say about utilizing or understanding these diagnoses too is it helps us understand what the intervention is so we can help that area. A language disorder, so this could be expressive or receptive language in order to help them get the speech and language pathology that they may need. Anxiety and depressive disorders, you know, sadly we do see this at a young age. And then this global developmental delay. So what that is specifically is for a child under the age of 5, a couple of things could happen that we may look at just a global developmental delay. So such as they're failing to meet expected developmental milestones within their IQ level. When the clinical severity, so we're not 100% able to see during their early childhood if they're picking up the skill and we want to continue to monitor it. Or, you know, honestly, it doesn't happen frequently, but if they're not able to participate in testing. So again, I believe, and this is my opinion, I suppose, that we create an environment here that even a very anxious kiddo or one that's really struggling gets a level of comfort and they're able to engage in testing. However, you know, occasionally it is a lot for kids. So we'll break it up into really small sessions, just trying to get any information we can. However, if they're not able to fully participate, this could be an area, the developmental delay. And what this diagnosis also requires is reassessment. So we would never just diagnose this and that's it. We would look at reassessment over time. So next, let's move into the elementary and junior high school years. So again, this is a very broad area. It's going to be 2 slides because there's a lot of information here. And the reason why I put them together is because a lot of these areas we see starting in kindergarten all the way up even into high school. So let's see. First we have academic. Academic is a very large area of our referral source. You know, they're not making progress in reading, as an example. They're below grade level. Their penmanship is really poor. They can't stay in the lines. They're not learning new concepts. And what it also I think is a really important area is how other areas of struggle may impact someone's academics. So as an example, and we'll get to it in a minute, is how poor attentional concerns can absolutely impact academic struggles. So for example, if an individual is not able to attend to new information coming in, let's say they're just really distracted or inattentive or really impulsive or, you know, just acting out, they may not be taking in the new information, which would mean we really need to work on attention as well as potentially if they're behind academically. Another area that can be integrated into academics is a language disorder. So let's say an individual is not able to take in or understand what's being asked of them, they may get frustrated, they may not know how to move forward, or even ask for help, which means, again, they may not learn the new information. Next is behavioral problems. Again, a big area that we hear. So, as example, the individual's acting out in the classroom, they're talking out of turn, they're really distracting their peers, pretty irritable or angry or cranky, they're not listening at home, they don't follow directions. So again, I think there's a pattern here. You can see how is this behavior, is it an emotional concern? If they're really, really maybe sad or unhappy and they're just acting out angry, because that's a frequent occurrence for young kids. Potentially, though, is it related to their academic environment? So are they acting out to get attention because the classroom is so large and they're really requiring more attention? Or are they acting out potentially or having some behavior problems because academics are really hard? So they don't want to do it. It's a big challenge. So it's easier sometimes to distract or do anything kind of but what's hard. And, you know, I think that's kind of how all of us pick our professions and what we do in life too. We do what we like and what we feel we're good at, and we might kind of avoid things or kind of push away from things that we're not. But obviously the way that we present them and overtly our behavior with them can change. And if it's a problem, you know, we might want to see what's under that. You know, it could also be, like I said, the impulsive behavior too. Are they acting out impulsively, not realizing that they're doing it due to an attentional concern? So jumping into the attentional concerns, a lot of areas too where I think neuropsych, at least where we do neuropsych at Family Institute, I think is beneficial because we do utilize the collateral data. So we're going to ask the teachers about the classroom. So behavioral problems and attention problems and definitely academic problems can also be influenced by the class size, other children in the class, where they're sitting in the class. Is it an advanced curriculum or is it pretty typically aged peer curriculum? All of that is influenced. So within a neuropsych eval, we're going to utilize the teacher data as well as even a school observation as needed to see the child in their environment. So going back to attention, you know, triggers or red flags that parents may talk about, trouble staying focused, talking to peers, not turning in or completing their work. And again, how we kind of talked before is their attention concerns are likely over time, they may impact their academics. It can impact their behavior, even social emotional at this point too, if they're really struggling to stay attuned to their peers. Next, we have visual spatial difficulties. So this could be the individual is struggling with visual material. Maybe they can't line up the numbers in math, or they're not bringing the decimal point down all the way. Visual motor integration, so this could be also related to handwriting, cutting, staying in the lines while drawing, visual perceptual skills, so they may not adequately be able to see the board in the classroom. I've had a couple instances where children have had really low visual spatial difficulties, and we've consulted with an eye doctor, and the child had a screening, and their depth perception was actually a little bit weakened. And so they really weren't able to discriminate and see all the material in the way that it should have been presented, which led to the use of prism glasses to help. And that was, you know, what we did through our testing to be able to see the visual spatial skills. Let's see. Visual spatial, one more, can also impact social skills. So if you think about so much what we do socially, which is also hard to do a webinar on the phone because I'm not able to see anyone's reactions, and obviously you aren't able to see me, but not able to see the environment and utilize nonverbals and gestures. If an individual isn't able to do that based on visual spatial or visual struggles, they may also struggle socially because they're not relating to what's being given to them in the environment. So this sometimes can be related as well. Language. So again, we touched on this throughout all of the other areas, but are they not following directions? Are they not following directions because they don't understand the directions or the language components of what's being asked of them? Or are they not following directions maybe because they don't know how to do it? So maybe it is an academic problem, a reading problem, a math problem. Are they not paying attention? So this is how attention and language can be related. Let's see, another area that we look at for language is word finding. So this could be, it takes them a little longer to come up with what they want to say. It's kind of like the tip of the tongue sensation that people get, like, you know, it's the tip of my tongue, I can't think of the word. But if this individual is doing it frequently, or using empty speech, so instead of using the word they're trying to think of, they may say words such as like, things, stuff. So using empty language, so this could be a word-finding struggle that we're able to look at. And then next is social language. So we do get quite a bit of referrals for a parent will come in and say, my child just is kind of awkward. They're really struggling socially. They don't have a best friend. They really want friends, and they want to fit in, but they don't know how. So, you know, occasionally it can be a social, emotional, or attention that we've talked about, but also it could be that it's hard for them to connect because they may struggle to see another person's perspective. They may struggle with inferences, with ironic speech, slang, sarcasm, and in our society and in the English language, we use that a lot. So we are able to do some social language testing to see if they're not understanding social language or pragmatic language effectively enough, and it's impacting them socially. So as you can already see, the whole theme of neuropsych is how everything is really interrelated and interconnected. And so we're going to look at least briefly on all of these areas to make sure they're at the areas where they need to be or where struggles may lie. Couple more for elementary and junior high years. So executive functioning deficits. So this is a very large area that we look at. So we have organizing homework, organizing after-school activities. You know, kids are very highly scheduled, which leads to time management problems. You know, as they age developmentally, we'd want them to start taking some independence, but are they not able to do that? Trouble adapting to new situations. So, you know, families that require kids to move between different homes throughout the week or the month, they may struggle in this area. Are they really forgetful? Are they difficult times switching between classes or activities? Do you have to consistently remind them to turn in their homework, check their grades? You know, a lot of things are online now. This is a pretty significant area we look at, and it continues to be an area throughout young adulthood. These are just kind of some examples in the early years. And then the last area that I'm going to talk about for this developmental period are social-emotional struggles. So difficulty forming, maintaining relationships. So just with this statement, it could be that they're really worried about relationships, or maybe they're experiencing some depressive symptomology and they're just really isolated, or it feels like it's going to be too hard to make new relationships. Sharing and compromising, playing with others, perspective taking that we just spoke about, low self-esteem, worry, stress, anxiety. Are they unhappy? Do they feel it's hard to connect with others? So these are frequent examples of what we see throughout this developmental period. So some examples, learning disorders, very highly looked at area. And we're going to look at what grade they're in and where they should be based on the skills they should be learning and what they should have achieved and where they are. That's how we're relating to their same age peers, as well as their own strengths and weaknesses within the academic areas. ADHD, or attention deficit hyperactivity disorder, we of course always look at. Language, which we spoke about on the last slide, as well as social pragmatic communication disorder. So this is a fairly newer diagnosis. And it's for those kiddos we were talking about in the last slide that maybe really struggle socially to understand nonverbals. These are the individuals that are struggling to connect with peers and understand another person's perspective. Do they struggle when they meet new people? Are they kind of, they're the awkward kids. And, there's not a problem to be awkward, but if it's impacting their functioning, then we might look a little deeper into it. So this is that newer diagnosis that we have, anxiety and depressive disorders, intellectual disabilities, we might look at that if they're under the level where we want them to be, and then we can talk about if there are any additional interventions that could be helpful for these individuals, potentially with self-care or activities of daily living. And then, of course, autism spectrum again. This will continue to pop up during elementary and junior high years at points because it potentially wasn't caught at a younger age, and so we can, of course, still look at that and test for it. Next, high school years. All right, so we have more requirements of individuals as they move into high school. So they are required to be more independent. So occasionally we'll get a family that comes in and says, he's moving into high school, he or she is moving into high school, and they their grades have massively dropped. Or they're really struggling to connect to their new peers. They were in, a lot of times in Chicago area too, a lot of the schools are K through 8, and so individuals are with their same peers for that many years, and then they switch to a whole new environment for high school with more demands and more classes, and that can create a lot of struggles for people. Are parents needing to step in more? So we get this frequently as well. Parents may say, if I don't pester them every night to do their homework or ask to see it, they're not doing it. So we're going to look at this emerging independence that we want high school students to have. So academic, as I just alluded to, grades are dropping or poor test taking. So test taking in high school years, as we all know, becomes really important, especially if the individual is wanting to go on to further education. So, areas that this could be. So is it anxiety, testing anxiety? Is it performance anxiety? Is it poor attention? They're getting really easily distracted. Is it an academic problem? So are they not able to grasp, or not grasping the material, so they can't show it on their evaluations? A lot of times too, especially these bright kiddos, they're able to compensate in the younger years. And then as material gets harder for them, they're not able to compensate and it becomes more challenging. So that's a frequent red flag or trigger that we see in the high school kids. Next, just like before, executive functioning definitely sticks around. So potentially they can't organize their materials, especially with high school students that are having to switch between classes, turning in their homework late. They're frequently tardy to every class. They can't make the transitions between class, can't figure out when they go to their locker or how many books should they take with them at once. Another area of executive functioning that I think we overlook at times is how they're able to monitor their emotional reactions in different situations. So we look at, is someone having a really big reaction based on something that shouldn't have a big reaction? So executive functioning and social emotional can absolutely be related. Long-term multi-step problem solving, this is a common one that comes up too. They can't, if you ask them to do a multi-step problem, they do the first thing and then they forget everything else. Relationship difficulties. So these start to really show in high school. So we're going to look at romantic relationships, peer, family struggles, family dynamics. We want to know how an individual is able to navigate relationships and how they deal with conflict. This can, again, allude to something else going on. Could be emotional, can be attention and nature, can be the social pragmatic, like we talked about in the last slide. And then we have emotional. So emotional concerns kind of start to increase again in high school. We, of course, we see them before, but this is an area where we see it frequently. So, we might hear that they've recently become more isolated. They're having some performance anxiety, overall worry. They're really sad most days. History of self-harm. A lot of times too, we see these individuals that are in an environment where they feel a lot of pressure. There's a lot of competitiveness in many of the high schools. And do they worry about their future? Are they thinking already 5 years ahead into college and they don't think they can do it? And is that impacting their current functioning? So within the diagnosis side, so we have ADHD again, as well as learning disorders, And then we have a lot of the psychiatric disorders that start to really show up, so the emotional disorders. So these would be anxiety and depressive disorders, eating disorders, obsessive compulsive disorder, OCD, trauma disorders. So for trauma, I know I originally actually had it listed earlier because, sadly we do see it earlier. But obviously as kids age and experiences occur, we see it more frequently at this time. However, again, realistically, we can see it at any period of someone's life. So we can look at it and discuss it in every age range. Next, young adulthood. So this is when we were talking about the transition after high school. So there's many things that individuals can do nowadays. They can take a gap year. They can go do a 2-year community school. They can go to a 4-year school. They can go right into a job. They can kind of choose to do none of the above. So we want to see the transition to whatever they choose to do. So to start with, transition to a higher education. So this could be an associate's degree, bachelor's degree, vocational school. So organizing their schedule and homework. So especially at some of the schools they go away to, maybe potentially first time away from home, they may have to get to school or to class on their own, which means they have to get out of bed on their own. They have their homework they have to organize. When do they do it? Maybe they have a class in the morning and a huge break and then a night class. That's not typical for high school. So how is an individual able to plan their day effectively? Are they starting to fail? Their grades are going down, and leaving home. So a lot of times, like I spoke about in high school, and very frequently for this young adult age, is parents do a lot. Caregivers do a lot for their kids, we know, and after they leave, occasionally kids can't keep up on their own. So that's a typical presenting concern that we see, poor organizational structure, and then another area is when these kids leave home is the influence of peer pressure. So new environment for a lot of kids, how are they able to monitor themselves, their values, their morals, feel good about what they're doing and make the choices that they want, and how is it impacting them afterwards. Next, trouble holding a first job. So a lot of times what we see, and kind of some cases that I've taken, are the individual is frequently fired. They can't hold on a job, and they don't know why. Frequently we hear they can't make it to work on time. They aren't taking feedback from their supervisor well. They can't organize their responsibilities. What else? They can't ask for help. They're struggling with conflicts. And then prioritizing their tasks, as well as their own needs. So are they doing what they need to do for work as well as themselves? Is one side getting to be a little bit too much? Then engagement in graduate school. So we also get individuals that they're done with the traditional 4-year university and then they want to go on to graduate studies. So what we see here are individuals with a higher or increased academic load. So again, talking about the high school kids that are really bright, that could compensate earlier, we also see this with individuals that are moving to graduate school, that college was pretty simple for them. So they were able to do it pretty easily, and then the switch to graduate school is really hard for them, and they just can't make it, and they're wondering why. Also, the switch to college or to a full-time job can be challenging, or vice versa. They went to the job world, and then they decided to go back to college. So that could be stressors of being out of their group for so long. And then lastly in this area, so standardized testing. So it's talking about the GMAT, the LSAT, any of the graduate standardized testing. Occasionally, individuals really struggle on that. So what's going on there? Is it an academic component they didn't learn? Is it attention or potentially anxiety? And lastly, interpersonal difficulties. So at this age, we're seeing more serious interpersonal relationships. So people come in with more conflict, living together with someone for the first time, problems with commitment, compromise, splitting up tasks in the household. These are frequent areas that we see as well. So last area for diagnoses, so we still have the anxiety and depressive. ADHD should be on there. It's still, it's at the bottom. My apologies, something we see quite frequently. And again, a lot of the emotional or psychiatric disorders, so bipolar within this age range is a time when the first manic episode may show up. Psychotic disorders, also the first psychotic episode can come up within this age range. Substance use disorders, and again, trauma. So I'm almost done here, and then we will take questions. So, what if you're thinking like, my kid is doing fairly well, but I'm still curious of their strengths and weaknesses. Is assessment appropriate? So we can absolutely look, and we've done this quite frequently, at a baseline of their functioning. It helps throughout their lifespan to see what their strengths and weaknesses are and to help foster those strengths and grow the weaknesses. So areas we'll look at are IQ, their academic baseline, their executive functioning strategies, and their personality structure. So yeah, a lot of times there's not like a specific red flag we hear from parents, but something's off, just slightly off, or they just want a fuller picture of their child's functioning. Let's see, greater appreciation of their strengths and weaknesses, how it impacts them, determine how they learn best, the different types of environment. We do gifted testing, and then of course, retesting. So this would be the reassessment. So for example, a lot of schools require testing to take place every 3 years. So after you have an evaluation, it, quote unquote, expires in 3 years. So we'd have to retest to see where they're functioning 3 years later, especially after interventions. We can do that. And then what now? So you already did the evaluation and you're done. The testing is complete. I don't have to see your child after that. So what do we do? So now we have feedback. So what we do in feedback is it addresses the referral question and presenting problem, what you came in with, as well as anything that came up in testing we're going to talk about. We'll talk about strengths and weaknesses, overall discussion on what to do next. Who comes into feedback? The caregivers, and then it's kind of up to the discretion of that person. So it can be the school, it could be the therapist, outside providers. We could do multiple feedback sessions. So occasionally we'll have a feedback session describing to parents what happened, and then we can also use neuropsych testing in the school setting and talk to school about where the struggles lie that we notice and how school can help accommodate for those struggles. So with that, we're going to neuropsych gives individual recommendations. So some examples are school recommendations. This could be, people talk about 504 plans or IEPs to help with whatever weakness or diagnoses that we see. Speech and language pathology, occupational therapy. There can be a therapy recommendation, especially if there's a social emotional concern, psychiatry that we always talk about as appropriate, social groups, etc. Other areas that we look at are exercise. We'll talk about nutrition, home ideas for homework for parents, boundaries to help set up for kiddos. And then lastly, we can also talk about informal ideas to utilize in the home environment based on what we found in the evaluation. So for example, I might give some informal ideas for a child with a reading disorder. Formal would be working with a reading specialist, but informally we can talk about how to work on reading at home, how to play games that utilize reading, should you be reading out loud, together, the parent reading, or an audiobook. We can talk about those as well. Another example is how to increase language use in the house, especially for kids that struggle with expressive language or even telling jokes. And lastly, visual spatial skills, how to work on those at home, increase processing speed or memory games. Okay, so that's all I have as of now. So I think I'm going to turn it over to Cassie to see about questions that we have to see how I can help.
Awesome. Yeah, this is really helpful, Renee. And we have some questions that have come in from the audience. And we'll start with this upvoted question from Mercy asking, when applying for college, how should kids inform or hide the diagnoses or difficulties with their potential colleges while still being a standout candidate?
Oh, really, really good question. So, I don't think there is exact right or wrong answer to this, but the one thing I would say, if, let's say, you someone has ADHD, let's say, and they really benefit from extended time and they want to use it in college. You wouldn't be able to get that extended time if you hid the diagnoses. So along those lines too is it is by law, they're not able, it's confidential. Any diagnoses that you do share with a school or university setting, so they're not able to share, and it is confidential. Obviously we know how the world works, but it should be confidential. And if you wanted to use accommodations or any additional assistance in school, I wouldn't say hide it because you won't be able to use them.
Mm-hmm. Mm-hmm. Yeah, and another question similarly with the transition to college. Someone wrote in, once I overcame the diagnostic difficulties, the challenge in recent years is to find the resources to match the needs as my child launched into college. Most resources on campus tend to be generic offerings, and my child is growing out the resources that have been effective while she was in high school.
Yeah, I'm just rereading it.
Yeah.
Yeah, so this is something we can absolutely do and also recommend specific people on campuses or in the areas wherever they're going to college. Because, I do agree they're pretty generic offerings. One of the differences, too, depending on where they go to school is the resources that they offer. So they may offer specific resources at a college that looks at kids with learning disorders. So they may have, specific reading resources for a college that looks at kids with LDs. However, if it's just a really big university, they may not offer that, especially within, if it were an IEP, essentially. They're not going to offer it. So what we would do is help you individually find those resources within the area that they're going to help. Another example I'm thinking of for that is kind of like an executive functioning coach. So within the Chicago area, we have a couple of people we really like, and schools will help with a child, such as checking their planner for them, making sure they know the homework, allowing them to have extra time, have a project broken up, but college likely won't do that. So what we would see is A, if the college is going to offer anything like that as specific as possible, or B, help you find something that can mimic it as best possible, even though it may be something extra, it may be something not offered by the university. And in my experience, universities really differ. So, as an example, I was just at a college in the city not long ago, and they would allow kids to utilize extended time and also extra help in math with a tutor they were going to offer, but they were not allowing the child to not take the math class, if that makes sense. So they were still making them take it, but they would offer additional help, so they would offer that. But yeah, sometimes it is starting a little bit fresh when you go to a different learning environment, sadly.
Yeah, definitely. And I know you've mentioned, Renee, IEPs in schools. A question came in, how do school district IEP evaluations differ from private consultations? And how do they work?
Really good question. So if anyone's been in an IEP meeting, I've been in a bunch of them, very different from private consultants or consultations and private schools. So within an IEP, if people don't know what that is, an individualized education program, and it looks at 8 different domains of where a child has to be pulled out for service. So essentially, it can't be done in the classroom. So it's not really extended time because the teacher can just give extended time, but it's going to be like extra reading support or work with a speech and language pathologist. So it's very specific, and we would be asking for those. And very specifically, they need to meet with the reading specialist, they need to work with a speech and language pathologist, so on. Privately, so I'm not 100% sure what was meant by the private consultation, but I'll talk about what I think it might mean. So private consultations, if it's a private school, they're a little bit more open to offering various help, accommodations or help, not necessarily saying it might be included within the tuition. However, they are able to offer it, whereas if you need a formal IEP, it has to be formally decided upon with the group, which would likely be the caseworker, social worker, teacher, learning coordinator at the school, psychologist. everyone would have to agree on it, and that sometimes is a little bit harder to do. If you get it, then awesome, and it's really great for the student. Privately is sometimes a little bit easier because you can say what you need, and hopefully they'll give it to you, as well as using private tutors on the side. So of course, if you're able to do that, timing financially, you're able to say exactly what you need and get those services. I think IEP meetings can go lots of different ways, and I've seen lots of different ones. I've been in them where they're very kind and everyone is really open to help the child. There's other ones that are a little bit harder because there's a little bit of back and forth between what one person thinks and what another person thinks, and obviously the goal is in the end, how can we all work together to help the child? So long-winded answer, but traditional IEP is a long process. It's worth it in the end, I would say. Privately, it's a little bit easier to get it started, and sometimes it can be just slightly more focused.
Mm-hmm. Yeah, Renee, this has been really helpful. And, we have a few more minutes before the end of the hour. And, just thinking about some of the folks, your closing notes, and of course, the folks on the call who have not done a psychological assessment with their child. Do you have any advice for folks who are deciding if this is something that might work for them, as well as any other closing notes you may have?
Yeah, no, it's a good question. So if you're on the fence, if you have a question to begin with, at least I am, and my team at Family Institute, send us a question. You can email us and ask, hey, I heard your discussion, and it really resonated with me that they're just not able to pay attention at school, yet they're okay at home. Is this appropriate? We're 100% willing to do that. If you're curious about just where your child's functioning is, I always say it's a beneficial tool because you're going to learn so much about your child. I always tell members of my team, too, that one of the biggest compliments is we see one kid for testing, and then the parents say, you know what, we learned so much about our older child. We want to actually have our younger child assessed, too, just to see where they're functioning. And then as I alluded to at the beginning, if you're interested in knowing what it looks like, so basically we're in a testing room together, we're downtown, we're working together with them all day, and it's 2 days, so a day and a half usually for kids, and we want to see how they are in the morning and the afternoon, because kids vary, definitely after lunch, before lunch, and we're just going to learn a lot about them, and we'll be able to help you as parents, help them learn better, and help get along within the household and with their peers. So again, if any questions, if anyone has further comments or questions, please, feel free to email me. I'm always open to that. And my information is on that last screen too.
Great. Renee, thank you so much for sharing all of this really helpful information with the group today. And of course, thanks to everybody for attending today's webinar. You can find all of our archived and upcoming presentations on our website at alumni.northwestern.edu/career webinars. We hope you all have a great rest of your day, and go Cats.
Thank you.
Take care.